how I know when I've gone deep enough is you hear the high pitch of the machine. And so once I know I hit the dermis, and how I know is that when I hear the machine start to drag a little, you hear the grind a little bit.
I do.
It's very subtle. That's when I know that I've hit your dermis. Because your dermis is thicker than your epidermis. The epidermis has 5 thin layers, and your dermis has 2 lower layers, and that's where all your blood vessels and the thick tissue is. So the reason that it stays is because we're implanting it into the dermis, which is the deep part.
Must be really thin needles if you've got 5 of them.
Yes, the 5 on the cluster of needles that I have, is that what you're talking about? Mm-hmm. They are very fine, thin needles. It's amazing because when we're talking about the skin too, the skin is very thin itself, and it's amazing that there's that many layers, but they're all very thin layers. If you listen a little bit more, you can start to get used to that grind.
Yeah.
Isn't that funny? A lot of people looking at this think it looks painful, but you're not feeling anything,
It's
right?
not painful at all. It's
What
not,
do you
not uncomfortable. You just feel a little pressure and
pressure, and vibration. Would you
little
say?
vibration.
But no pain.
No pain at all.
That's great. That's the way we want it. Okay, we are now halfway through our process, and we are finished with her brows, and we have just applied some antibiotic ointment. So we have just reapplied numbing cream on her eyes for eyeliner. And she should be numb because we had the numbing cream on there while we were still doing her brows. So we are going to test her first and make sure that she is numb before we start. We have chosen jet black for her upper lid, and on her lower eyeliner we're going to do a black brown. So I'm going to test you first, Becky, out here on the outside, and just see, tell me if you feel sharp.
A little bit.
Okay.
Just a little.
Let me let that get on there a little bit more. On a scale of 1 to 10, 10 is the worst, what would you say the sharpness is of that on a scale of 1 to 10?
Just a 1 or 2.
Okay, really minimal. So it's a little bit dull.
Right.
So we just need to get it a little bit more numb. Okay. How about right there?
Just dull.
Real dull. Okay. Glad that we reapplied. Well, I'm going to start with just 1, 2, 3.
Okay.
And tell me if you feel anything. And you'll keep your eye closed the whole time. You should just feel pressure, a little bit of vibration. It does feel like I'm coming in on your eye. It's very close to the lash line, but your eye is totally closed and protected at all times, okay?
Okay.
This is where we really build a trust factor here.
Yes.
Okay. Wipe this clean. Are you still feeling it as I get a little more into the center?
Just a little.
Okay. Would you say this is painful at all now?
This is not painful
Good.
at all.
Good. Just a little pressure. Does it feel a little tickly at all on the cornea of your eye?
Not tickly. I feel pressure and I
Okay.
feel the rotation or the vibration.
Vibration, okay. I'm going to come in here just one at a time. You tell me when you start to feel it.
Oh, I really like this.
Is that pretty?
Yeah, it sure is. Well, you do a nice job. Thank you very much.
That's so good.
It really does. Really does.
I'll sit you up. It always looks different too when you sit up.
Okay. Oh, it looks better sitting up even. This looks just like when I put it on myself.
Good.
Exactly how I do.
Good. Now I still see that this one is a little bit touch higher, but you know, let's wait and we'll add just a little bit more. We don't want to keep adding more immediately after because
Right.
we could be compensating for swelling. But you know, another thing, once Dr. Short also gives you Botox, that can help even that out too. Definitely.
I don't really see the
Because you won't be
unevenness
doing
that-
this as much
Oh,
once
that.
the Botox. Do you see that? Yeah,
Yeah.
because it raises it.
Yeah.
Yeah.
I won't be able to do that.
You will not. That's right. Wow.
Thank you so much.
What a big difference.
Big
What did
difference.
we do with her?
It's amazing.
It's
Isn't
awesome,
it?
doesn't it? She did good.
Oh, you did good. Thank you so much.
You're a very good patient. No scabbing at all. So a couple times tonight, we've put cold compresses on so it doesn't look like you're going to ooze a lot. But at least once every 2 hours this evening, I want you to take this off with a tissue or something soft, and then I want you to reapply.
Okay.
Okay, with a Q-tip on the brow, and that's just Neosporin or antibiotic ointment.
Okay.
Now I'm going to give you this bacitracin ophthalmic ointment, and that's going to
Okay.
be just for your eye, and it's a little bit lighter in texture, so it's not real heavy and doesn't go everywhere.
And I just do this for 2 days?
48 hours, and
Okay.
that's it. Okay, so first I'm going to have you close your eyes, and I'm going to do it on your upper lid right along the lash line, and you just want to keep that moist. Now if a little bit of this gets in your eye, that's okay. It just makes it a touch blurry, but it doesn't hurt it. And like I said, you can do some cold compresses tonight to help with the swelling. When you wake up in the morning, it'll look like you've been crying, but as you are up and about, that will subside. I'm going to have you
Okay.
open and look way up high. I'm going to rub that right along the bottom. I'm going to give you this little micro brush to use at home, so you can get right on that line. In just 48 hours, and you can go back to normal.
That is great.
Okay, you're all set.
Thank you.
You're welcome.